In this lesson, we will make an in-depth analysis on how cultural competence integrates into health assessments. What is cultural competence? Cultural competence refers to the ability of healthcare professionals and organizations to effectively interact with individuals from diverse cultural backgrounds. It involves understanding, respecting, and addressing the cultural beliefs, values, and practices of communities in ways that enhance health outcomes and reduce disparities. When applied to health assessments, cultural competence ensures that data collection, interpretation, and intervention strategies are inclusive, equitable, and sensitive to the unique needs of diverse populations. Let's see now. Why is cultural competence important in health assessments? It promotes equity and inclusion. Communities often differ in their beliefs, health practices, and access to care, which influence their health outcomes. Integrating cultural competence ensures fair representation of populations, especially marginalized or underserved groups, in health assessments. B. Improves data accuracy. Culturally irrelevant or poorly worded survey tools may lead to miscommunication and inaccurate data collection. A culturally competent approach ensures that language, phrasing, and methods are adapted to the community's context, improving the reliability of the data. C. Builds trust. Historical exploitation and systemic inequities have created mistrust in many communities, particularly among racial and ethnic minorities. Respecting cultural values and involving communities in the assessment process fosters trust and collaboration. D. Enhances intervention effectiveness. Health interventions based on culturally competent assessments are more likely to be accepted and effective because they align with the community's values and practices. In this section, we will talk about key components of cultural competence in health assessments. A. Understanding the community's cultural context. Learn about the sociocultural factors that influence health behaviors, such as religion, traditions, family structures, and language. Example: in some cultures, health decisions are made collectively by families rather than individuals. B. Inclusive data collection. Design surveys and focus groups that consider language, literacy levels, and cultural norms. Example: offering translated materials and hiring interpreters ensures language accessibility. C. Community involvement. Engage community leaders, cultural brokers, and stakeholders in the design and implementation of health assessments. Example: involving tribal leaders in assessments of indigenous populations ensures respect for traditions and practices. D. Training health professionals. Train public health professionals in cultural humility and awareness to avoid biases during data collection and interpretation. Example: understanding nonverbal communication differences can prevent misinterpretation of body language. E. Addressing social determinants of health. STO. Recognize how cultural and systemic factors, such as racism and poverty, shape health outcomes. Example: assessing the impact of housing insecurity or discrimination on specific cultural groups. F. Tailoring communication. Use culturally appropriate communication methods that resonate with the target population. Example: in oral cultures, storytelling may be more effective than written materials for health education. Integrating cultural competence into public health assessments presents several challenges. A significant issue is the lack of training and awareness among public health professionals, which limits their ability to identify and address cultural differences effectively. Additionally, language and literacy barriers hinder participation from communities with limited English proficiency or low literacy levels, making it difficult for them to engage in health assessments. Another challenge is stereotyping and bias, as health practitioners may unintentionally rely on stereotypes, leading to biased assessments and potentially alienating patients. Furthermore, implementing cultural competence often requires substantial resources, such as hiring specialized staff, translators, or developing culturally adapted tools, which can strain organizational budgets. Lastly, ethical concerns arise when balancing cultural respect with modern health guidelines, particularly in cases where traditional practices conflict with evidence-based health recommendations. Addressing these challenges requires systemic changes, ongoing training, and a commitment to equity in healthcare delivery. Embedding cultural competence into health assessments is essential for delivering equitable, effective, and respectful care to diverse populations. As we move forward, the next lesson will bring these concepts to life by examining real-world examples of cultural competence in action, illustrating how these strategies are applied across diverse healthcare settings. We will also investigate the broader benefits of cultural competence in health assessments, highlighting how culturally responsive practices lead to improved health outcomes, enhanced patient satisfaction, and more equitable healthcare systems overall.